Hello again, and welcome to the Prevention is the New Cure podcast. I'm Steve Brine. I'm the MP for Winchester in Hampshire, and I'm chair of the Health and Social Care Select Committee in the House of Commons.
And I'm Helen Stokes-Lampard. I'm a frontline general practitioner in Lichfield in the Midlands. I'm chair of the Academy of Medical Royal Colleges, chair of the National Academy of Social Prescribing, and tonight, also of relevance, I happen to also be a trustee of Macmillan Cancer.
Now, why is that relevant, Helen? Because as you will see on the photo that we put along the social media post with this episode, we are actually in the same place, which for those who listen to this podcast, we're not always in the same place when we record it. In fact, I think we've only managed that once in our time doing it so far.
We haven't. Sometimes we're not even in the same country.
Sometimes not in the same country. But we are in the same place. We're in the same room recording this because you are here today for what? Macmillan?
So Macmillan have got an event over, a parliamentary event. Get this, it's the parliamentary tug of war, the House of Lords versus the House of Commons, all a fundraising event for Macmillan Cancer, which is going to be hilarious. It's a glorious evening here in Westminster. And I'm just hoping nobody puts their back out, because I'd much rather not be the GP on site if that comes to it tonight.
Yeah, well, you know, I have bad form with tug of war, actually, Helen. In my constituency, at the Grattan Festival in Sutton, Scotland one year, they were like, come on, Steve, you do it. And I did, and then I looked like a right fool with a bad back and all that. So
yeah, it can end badly.
I'm just going to watch this evening's proceedings and just supervise. I'm going to supervise what's going on. Anyway, so you're here for a parliamentary tug, which is good. It's been said before. And Commons versus Lords. Who's the favourite? I mean, who would you say is in pole position?
I think it's fair to say that to the casual observer who didn't understand the nuance of these things, that just looking at the demographic of the House of Lords, the demographics of the House of Commons, one would tend to put one's money on the Commons. But there's a lot more nuance to it than that. It's not the entire population of each of the houses. There are self-selecting individuals, and there are lots of battles to be fought in between. So I think it's really open, and I'm looking forward to seeing it. And I'm not a betting person.
And I said to you earlier, are you doing the tug of war? And you said, in these shoes.
In these shoes and in this frock, you are kidding me.
Okay, right.
I've promised no.
Well, look, there's so many things to talk about. We just say thank you to Dr. Luke Evans, MP, who was our guest on the pod last week. And we've had some fantastic feedback and huge numbers of people listening to it. He was talking about his body image campaign. He was fun, wasn't he?
It was brilliant fun. He was very clear. And his campaign is something that's really easy to understand and to get behind. So, yeah, great podcast episode. Thank you, Luke. We really enjoyed having you on the pod.
Yeah, so I think it was episode 7 last week. So if you find that on your podcast platform of choice, and when you're there, please follow our show, which helps us, and you'll then get notifications of when we put a new episode up. Now, there are, in my opinion, my humble opinion, Helen, there are 2 issues right now which just seem to have shot up the news agenda, the political agenda, and everywhere you turn, someone's talking about these things.
Yeah.
One of them is vaping.
Yeah, agreed.
The other one is
AI.
So
Absolutely.
let's start with both of them, because they both have very clear implications for health and for prevention. So on the AI, so I once went, he says, dropping names, to the G20 in Argentina.
That's very cool.
Davies, who was then the chief medical officer, and we did a presentation to the G20 health ministers about the whole issue of microbial resistance. So AMR, antimicrobial resistance. And we did a demo as to what would happen if there was a major outbreak. I mean, this was a few years before COVID. But anyway, there's been a development in the last few weeks around artificial intelligence and antimicrobial resistance. What is it, Doctor?
So, yeah, thanks, Steve. So this is the application of AI to the very thorny issue of how we develop new antibiotics that can treat the bugs that are currently resistant to conventional antibiotics. And there are literally thousands and thousands of experimental antibiotics out there. The problem is, how do you know which ones to take through to the further stages and develop? And so an interesting exercise happened. AI was applied to this list of over 6,500 potential compounds, narrowed it down to a list of just over 200 that could be exciting. They then got tested, because that's a much more doable number for the scientists to test, and they found 9 or so really interesting ones, one of which looks to be a complete superstar. Now, I'm going to try and pronounce it. I think it's pronounced Abacin. Other pronunciations may be available.
Yeah.
And this one is highly, highly specific against a very nasty bacteria. which is one of the ones that the WHO say is one of the world's big critical threats, i.e., it is so resistant to everything that we have no idea if we'll ever be able to treat people who have it. If this turns out to be a real breakthrough, it could be a game changer.
Yeah, and I mean, I think it's something like more than 1 million people a year are estimated, aren't they, to die from infections that resist treatment with antibiotics. So, there's often, I remember this from my time in government, talking about, veterinary prescribing of antibiotics and in agriculture and in human medicine. So, the doctors are always slightly circumspect, aren't they, in terms of wanting to give out antibiotics. And that's not just because they're being mean. That's because they're trying to make sure that they're not overused, and then presumably you grow a resistance to them. Is that a fair summary?
A very good summary. And then we've seen a massive change over the last 30, 40 years. When you and I were kids and went to the GP for an ear infection, we'd have just been given antibiotics. What we now know is that in those situations, antibiotics may shorten the duration of the illness by 12 hours a day, but actually the exposure to so many antibiotics increases our chances of developing resistance later on. So we then get a much more serious infection that the antibiotics won't work for. So we're far more circumspect now. Of course, there's always that risk. Sepsis has gone up the agenda, and people understand that sepsis, life-threatening condition where infection gets out of control and body systems overreact. So there's always a delicate balancing act, but antibiotics have been transformative for healthcare since their inception. The problem is we're running out of options for many infections. And even commonly in general practice, we see it, people with multi-resistant urinary tract infections or wounds.
And previously mentioned Sally Davies, who's a former CMO for England. She's now the government's envoy on antimicrobial resistance. She said, we're onto a winner. I'm thrilled to see the work we're doing. It will save lives. And, Sally doesn't say anything lightly.
She certainly doesn't. She's hard to impress. And so if she's impressed, I'm impressed.
She was great fun to travel with as well. But that's a whole nother story.
I bet she was. Come on, Sally, come on the pod.
The other big one that's flown up the agenda, and we talked about this before, but I don't apologize for talking about it again, is this vaping issue. Now, on the select committee this week, we're going to have a special one-off session where we're going to get a number of people in, one of our topical sessions, and talk about this vaping issue. Why is vaping on the news agenda this week, Helen?
So we've talked about the disposable vapes. We've talked about kids and vaping. We've talked about all sorts of elements. What's happened this week is that Ash put out a response to the government's calls for what we could do best to improve the vaping situation. They've suggested taxing, they've all sorts of things about stopping appeal to children. What they haven't done is support a ban on disposable vapes.
The Ash Action on Smoking Health, just
indeed,
for those who
indeed. Sorry, thanks for explaining. Yeah, and Deborah Arnott, as you may recall,
we've had as a guest.
Yeah, and she was great a few weeks ago. And that's caused a bit of consternation because the Royal College of Paediatrics and Child Health have said, hang on, we want an absolute ban on disposable vapes. They have no use at all. They're what are attractive to children. And so there's a little bit of tension out there today, which is natural. I mean, 95% of what they want is exactly the same. But of course, it's the differences that people pick up on. Fundamentally, we want to protect our children and young people from unnecessary harms. What Ash is saying is that there are some vulnerable groups of people who've got learning difficulties, people who have got dexterity issues, who find the more sophisticated refillable vapes harder to use, and people who are more impoverished and poorer find the disposable vapes are cheaper. And so they don't want to take away the option of those people having help. And you can see where they're coming from. But I also see very much.
So when the story says children's doctors are calling for a complete ban on disposable vapes, that's because children are more likely to radiate towards the cheaper disposable product.
And if you remember, we picked up on that issue that there were free samples that could be given to kids. That was one of those loopholes we said must be cracked down on, that retailers can give free samples of vaping devices to young children. And so, we don't want children to start vaping. That's the big thing.
Yeah. And I mean, you can get them for about £5, can't you? I mean, it has, I mean, I hear about it in my mailbag as a constituency MP. And I mean, I hear about it as a parent as well. I mean, I've seen letters home on the subject of vaping. And, I sometimes I'm in the car with my son and he'll say, oh, that's so-and-so, he vapes. it's become a thing that people talk about now in relation to, he wears that jacket and he vapes. So the Prime Minister said it is ridiculous that vapes were designed and promoted to appeal to children when they were supposed to be used by adults given up smoking. The other side of this story, and why vapes just has been a recurring story in the last few weeks, is that BBC did an investigation that found unsafe levels of lead, nickel, and chromium.
That's right.
Yikes! In vapes confiscated from a secondary school, which could end up being inhaled into children's lungs. I'm not a doctor, but this doesn't sound good, Helen.
This is really, really bad. These are either carcinogens. These are things that could delay neurodevelopment, so brain development. So particularly where children are vulnerable, lead is the particular one there. We know there's a lot of evidence about it. And it is unbelievable to me that these things are actually the case. Now, these actually are in the illicit vapes. These are not in the regulated ones, which have to comply with high standards. These are in the unregulated illicit products. So there is an important difference there. But this was a very entrepreneurial head teacher who basically went out, confiscated a load of vapes for the kids, contacted the BBC and said, what do you want to do? Do you want to test some of these? And the BBC arranged for the analysis. So it was a really important bit of investigative journalism, and hats off to them.
Yeah. And of course, we should just be clear. If you're a child at secondary school and you are buying vapes, you shouldn't be doing so. You're not doing so legally, are you?
No. Absolutely.
And so there's an enforcement issue there, isn't there? And that is following up. Okay, we can take a quick break and then we're going to come back. We'll talk about sex and weather.
Excellent. Welcome back, everyone. Well, we promised you sex and weather, and so that's what we're going to give you. Steve, what are we going to talk about?
Let's talk about sex. Do you remember that? Was it Salt and Pepper? Let's talk about sex, baby. Oh my God.
Let's stop there. Moving on.
That will be. Have you ever done karaoke?
I certainly have.
Have you done it with me?
No. There's a thing.
Yeah, I did karaoke night. So Therese Coffey, who's now Environment Secretary, organises karaoke night in here for the Parliament. Some members of the Parliamentary Party, and I'll never forget back in this must have been early in the Cameron years when George Osborne was Chancellor, and he did karaoke to Bills. You know that song? I got bills, I gotta pay.
Yeah, I know.
Brilliant, absolutely brilliant. Anyway. I digress.
Actually, but no, there's a good bit of social prescribing in there. Singing is good for your soul. It lifts your spirit, lots of those natural endorphins. It's great.
Susie, my wife, and I always say that one day when we have time, like, when we retire, or when I get thrown out, then we're going to join a choir.
Excellent.
Like a rock choir.
Oh, that would be fun.
Would you like that?
That would be really fun.
I'd see you in a rock choir.
I'd love a bit of that. I was in choirs for donkey's years as a youngster growing up in South Wales. Of course, I'm Welsh. It comes to blood.
Nice.
But much better in a choir than as a soloist. That's all you need to know, Steve. But it really does lift your soul singing. Really
yes, does. Excellent. And because it's been hot, I've never had a nicer half term weather-wise. Shorts all the way. Kids were happy, playing in the garden, dogs swimming in the river, loving it. It was great weather.
Sounds magical.
But there are health impacts to it being really hot. And what was the weather story that you flagged this week?
Yeah, I flagged this one up. It's interesting to see. We're going to introduce a hot weather alert system. You may remember a few weeks ago there was the National Emergency Alert Testing System on all mobile phones. I have to say my phone didn't ring on the alert emergency system, so it failed the test. I'm sure there'll be another test. But actually, this is something that a lot of EU countries have already got, that when there are severe weather warnings coming out, messages get sent out to the public in the relevant areas, warning them to protect themselves and protect the frail and the vulnerable. If you remember, last year, we hit, for the first time in the UK, 40 centigrade. I mean, that is unbelievable temperatures for us. Certainly, it's smashed all records. And at those sort of temperatures, it has a direct severe impact on health for anyone who's vulnerable or frail, and young children and pregnant women also,
So this is through the UK Health Security Agency, the UKHSA, which Jenny Harries, people remember from the COVID press conferences, leads that organisation. But what's the point of the alerts? I mean, what's the call to action that it's going to do then? So
the call to action is to take sensible preventative measures for yourself personally. So whether that's increasing your fluid intake, whether that's closing your curtains, doing all the things to keep your house as cool as possible, things that we don't intuitively do in the UK. Our houses are designed to keep warm, not to keep cool. But also it's a call to arms for those of us who are more able-bodied to look out for those who are vulnerable, checking in on people, particularly those who are isolated. I mean, the other thing is, to be honest with you, Steve, just looking out for our pets at a time like this, as caring pet owners in the UK. I know the pod's mostly about health prevention, but health for our pets matters too.
Yeah.
It's a
Okay.
whole society warning.
So
Take warm weather
there's
seriously.
going to be 4 alert colours. Green, no risk to health. You got yellow, means that heat could affect the particularly vulnerable, over 65, those underlying health condition you're talking about. Amber means the impact could affect the wider population, and red, significant risk to life, even for healthy people, and severe impact across all sectors. So yeah, okay. I mean, I can see that it's important, and I can see that we've got to understand that last year was the UK's warmest year.
Yeah.
And this century, I think we've had 15 of the top 20 warmest years, 10 of them in the past 2 decades. So it's getting warmer. And those in, I remember this from when I had this particular brief in government. Those in care homes are particularly vulnerable, aren't they?
They are, absolutely. And again, care homes mostly weren't built with keeping cool in mind. It was all about keeping warm and cozy, because we think about people in the cold. So this is a new thing. Let's see how it goes. I think, like all new systems, we're going to have to test it out, see if it works, and refine it over time. So there are bound to be a few glitches, but I think I'm really glad to see this coming. I think it's overdue.
Yeah. Okay. Well, on the sex part, if I may, so gonorrhea and syphilis infections have reached
nasty.
record levels in England.
Mhm.
Now, we talked about this before, but we are going to do a sexual health special on the podcast in coming months.
Mhm.
And a good friend of ours, Kevin Fenton, who some of you will know and who I work with through my work on the All Party Group on HIV and AIDS, is hoping to come on and talk to us. So if you've got questions and thoughts for the pod surgery in particular about sexual health, email podcast@stevebryan.com, or find us on podcast social media channels, Prevention is the New Cure, and throw them into us. Basically, the story is England is seeing record levels of gonorrhea and syphilis sexually transmitted infections following a bit of a dip for obvious reasons during the COVID years. How much do you see of this in the surgery, Helen? I mean, obviously you're not a sexual health clinic, but
to answer that specific question, a modest amount of it. What we get is a lot of questions. I'm going to take you back 1 second, Steve. You just asked people to send a lot of questions in. Just to be clear, we're not doing a personal advice line on your own sexual health problems. This is about the wider issue.
Yeah.
Fun though that might be,
that would be
that's
weird.
not what the podcast is for, really. I spent 6 months working in a genitourinary medicine clinic back in the day. Great source of some of my best after dinner stories, perhaps not for the podcast. But your specific question about, as a GP, how much we see of this. A lot of chlamydia we pick up, usually in young women who are in for other investigation, for sort of the standard cervical screening. Gonorrhea is one of the things you get outbreaks of gonorrhea. Syphilis is much less common. I mean, there were still under about 8,000 cases in the whole of the UK last year. But chlamydia is the really big one, over 200,000 cases. The pattern we've seen, of course, all of the sexually transmitted infections reduced when we were in the lockdown phases, as one would expect. Now, mostly we think that was that people had genuinely complied with the social distancing issues, but also there will be a certain element that people didn't come forward for infectious disease testing. However, this bounce back, for want of another descriptor, has been quite dramatic in terms of the numbers of cases have risen. And we do need to watch out for it, because the consequences of untreated sexually transmitted infections are really severe in terms of health.
Well, yeah, because it can lead to infertility, right? If you don't get on top of some of these STIs. I mean, look, I guess I'm a government MP, and I did hold this brief in government once, but I have to say that we have made cuts to sexual health services and public health budgets, and we are suffering a little bit of the consequences of that. And we saw that last year when the Mpox, the monkeypox outbreak happened, and sexual health clinics in some of the most affected areas were unable to provide HIV screening and STI testing because they were maxed out and they just didn't have the capacity to cope. So we're in a difficult position on this, and we're doing a sexual health work stream within a prevention inquiry on the select committee. And I don't think we're going to be short of advice and short of input on this one.
Do you know, in terms of bang for your buck, perhaps that's the wrong metaphor in this moment, but in terms of return on investment, that's what we mean. In terms of return for investment, £1 invested in sexual health services should return at least £8, if not up to £11 in terms of value for money. I mean, it's such a fantastically wise thing to invest in for any society. So please, let's invest more in sexual health services. And Steve, hidden within this story, there is a good news story,
Go on.
and that is the genital wart situation.
Right. No, it's not a sentence that I anticipated having this afternoon said to me. The
But
genital wart situation. Go on, do illuminate
let
me.
me tell you the illumination here. So, if you look at the graphs as to what's happened with cases of genital warts, they have been steadily falling. So, in 2013, we were talking around 80,000 cases a year, now down to about 25,000 cases a year, and that's plateaued. That hasn't risen post-pandemic, and that is directly related to the success of the HPV vaccination program, because the virus that causes genital warts is the same virus that is associated with cervical cancer, anal cancer, penile cancer, and you, I believe, sir, we have to partly thank for it anyway.
Yeah, well, we did extend it to boys, and I'm very
Hallelujah.
proud of that. I think that is a big preventative health measure, and
Yeah.
obviously it'll be a long way down the line where things won't happen that would have happened, and of course we don't know what we don't know. But I think that's in terms of preventative health measures, I'm pretty proud of that one.
We can see genital warts quickly, already a massive fall in that. And having done my time in geomedicine clinics, it's a pretty distressing problem to have. Treatment is painful, and people get recurrences. So to save people ever having the warts is a positive byproduct of the work to prevent all those genital cancers.
Yeah.
And so we'll track all the cancers over time. We're already seeing cervical cancer falling off a cliff. But how wonderful to be able to prevent things in such an overt way.
Well, look, I mean, preventing sexual health is critical. And I guess life and death, never is there anywhere that's more important than in cancer, which we've talked about so many times on the pod already. And there's been some quite interesting news on that this week, because the biggest cancer conference in the world has been taking place in the last week or so in Chicago, where I used to live, in the US. And this is about, linked to the Gallery blood test cancer trial. And, you may have seen it in the news on the front pages of some of the papers in the last few days. Actually, people really excited about what this promises. Could you just explain what the Gallery trial is and what this particular news story is?
Yeah, sure. So the conference you're referring to is the American Society of Oncology conference. So that's it, biggest cancer conference in the world, as you said. It does move around. So presented at it was some work done by the people. So Grail is the overarching company that own a test called the Gallery test. And the Gallery test, spelled with an I, includes 50 different cancer genetic risk things. So you take a blood test and you're looking for these 50 different genetic quirks, which are indicative or highly suspicious or high risk for developing different cancers. The massive study, the Gallery trial, is looking at people who have no symptoms at all, who just have a blood test done just to see what's there, what they find. And if they find you've got a risk for this, they then go looking to see, have you already got a cancer? And then they're going to follow you up. If you haven't got a cancer already, they're going to follow you up and retest you over time to see if you develop a cancer and how helpful this test has been at picking things up early. So that's ongoing. And clearly that has implications for screening in the future, because if it's proven to work, we'll want to roll it out throughout the NHS. So there's a question to come for the future. But they've done a sub-study, a smaller study called the Simplify study, where they use the same test, but this time on people who turned up for their GP with symptoms. They turn up, GP thinks, hang on, this could be a sign of cancer. I'm going to refer you fast to a cancer pathway to try and rule out cancer. They did the blood test as well, and this has shown that this increases the diagnostic capability and the accuracy. So some of the problems, if somebody turns up, for example, with anemia, so they're low on blood, actually we're not sure if it's a colorectal cancer or if it's lower gut, upper gut, or if it's another cancer that's causing it. Just to be clear, there are many other causes for anemia for people, but it's one of the things we do think of. Actually, this really helped pinpoint where to focus your energies to diagnose more quickly. However, a word of warning, and there will be scientists jumping up and down shouting at me if I don't say this. The work hadn't been peer reviewed, as I understand it, when the press release came out. So there's that anxiety. It needs to go through a full peer review process, but certainly it's exciting, and the researchers are high caliber, doing a lot of work. My conflict of interest, I'm on an oversight group that is external to all this, that provides oversight and clinical critique of the work they do. I'm looking to see what comes to us next.
Yeah, I mean, I think they said, it's a great explanation, that they said that it's very much a work in progress.
Yeah.
I think the research at Oxford University is how they put it. But I mean, basically what it does, it looks for distinct changes in bits of the genetic code that then leak from different cancers,
Right.
which then allow you, through that simple draw of blood, to spot treatable cancers very early. So that's the holy grail, isn't it? To be able to spot them pre-symptom, because even at, lost my father to pancreatic cancer, at symptom, that is too late. In many cases. Obviously in breast it's different if found early. But if the Gallery trial fulfills its promise, I mean, game change. I've just contributed to an article actually, which will be in the New Statesman later on this week, about what are the implications for a publicly funded health service of this coming through. Because obviously, at the moment it's available in the US commercially, is available controversially here in some commercial settings. But, what are the challenge for the politics of this? So, prevention with a political twist, is how do we fund this? Because we're a victim of our own success in many ways, because, we have a health service that's free to all, and we can't discriminate, and we shouldn't discriminate.
And this is the really important bit about prevention, where the cost effectiveness analysis around prevention is so important. And I would argue that it is vital that we do this original research and that others replicate the research, so that we are absolutely certain. So if we are going to spend NHS money on rolling this out to everybody, that fairly and equitably, that it really is the right thing, because it's so easy to get excited in the early phase responses of any trial, when actually the harsh reality, when you operationalize something across the general public, can be very different. So very exciting, but let's all be a little patient and do this properly, because if we do it properly, we can get answers that we can robustly defend.
Patience is a virtue. Welcome back. Prevention is the new cure. This is our little podcast with Steve Brine and Dr. Helen Stokes-Lampard. It's time for this. Pod surgery is open. Dr. Brine and real Dr. Stokes-Lampard, we'll see you now. So we've got a couple of things to talk about here. Dear Steve and Helen, this is from a GP in Sussex, and quite understandably doesn't want their name. The workforce plan. ... question mark.
You mean the fabled workforce plan?
You keep saying the fabled workforce plan, yes. And I know why you're saying that. And I'm guessing that the questioner's point is WTF is the workforce plan? Answer, I don't know. But I think, look, the bottom line is that I think it's inching towards being signed off within government. I like what we just talked about with the Gallery trial. I would rather it was done properly. I would rather we had a Prime Minister that goes through the detail. NHS England, Department, Number 10, Treasury, they've all got to be on board. Because if this is not a costly workforce plan with numbers in it, it's going to struggle. But what I would say to you is, Helen, Doctor, when it does come out, I think it'll be worth waiting for.
I really hope you're right, Steve. I mean, I joke about it being the fabled plan because we've been waiting for it for 7, 8, 9 months now. I think the key point of what you said was about it's got to have the numbers with it, so it'll have credibility when it lands. But we need something. I think the whole concept of a plan that we can all get behind and work with, because it certainly won't be right the first time. It'll need to evolve. It'll need to flex over time. It can be added to, but at least we'll have something which will be considerably better than we've had the last 75 years of the NHS, where we haven't had a plan of this nature. So I think it's important when it comes out, we all take a breath, read, get out of it what we can, but then look to see how we build on it and work with it and improve it going forward. That's my suspicion. So, I chair of the Academy of Medical Royal Colleges. So that's the 24 colleges and faculties that represent every branch of medicine. And they're all itching to see this.
Yeah, I bet.
We know that there won't be specific numbers about the various medical disciplines. So you
know
how many gynecologists more there'll be. There is likely to be an indication of the number of general practitioners, because that's such a huge branch. But it will give us an idea of how many more doctors we're likely to need and how many other healthcare professionals, because medicine is this whole orchestra of different professionals that work together in concert, literally, to provide care to patients. So I think that's why we're all itching to get an answer to it. So I'm with you, the anonymous GP from Surrey. Where is it? Please, let's have it too.
Sussex. Yeah, Sussex. Yeah. Okay, right, your turn. What do you got?
Well, I've got one from Fiona, or Geranium57, who emailed us about heart disease. Really interesting about how can we better educate the public about risks and complications. And she made a really important point that people seem more frightened of cancer than they do of heart disease. And I think there's something quite powerful that the big C
Yeah.
does terrify people more than heart disease. And that's, I don't know, what are your observations on that one?
Well, it's not an either or. They're both bad, and we got to tackle both. Which is, to be fair to the government, they're producing at the moment their consultation on the major condition strategy, which will include cancer and will include CVD, cardiovascular disease. I think maybe we do sometimes underplay heart disease because people think, oh well, it's familial and there are not wider environmental factors that could give you CVD, and indeed there are, right? There are many wider in environmental factors like air quality, for instance, that impacts on your ability to develop heart disease. Am I right there, doctor?
You're absolutely right. So it's environment and genetics, but there are so many things that we can do for ourselves and take control. I mean, in the same way, there are so many things we can do to prevent or reduce our chances of getting cancer. That information, sensible, balanced, accessible information is so important. And I think I don't want to terrify people. I think terrifying people about anything is generally very counterproductive. But for me as a healthcare professional, it's about those teachable moments when people come in and something's going wrong. It's how do we make every contact count? Sorry, I'm throwing in all the cliches now, aren't I? But it is that thing about, as a healthcare professional, pressing the button when somebody is, classic one, somebody's been listed for an operation and then you notice they're overweight. Their exercise tolerance isn't very good. If you optimize those things, they'll do so much better at the operation. If somebody's just had an accident, they've had care in hospital, and these few things are picked up, their cholesterol's high, if people can spend a moment and say, by the way, you really need to make some changes now to save yourself problems in future, I think that's something we can all get behind.
Yeah, amen. Okay, final one from me. So a constituent actually said this to me the other day when I was visiting a hospital. When you do the podcast, could you talk about the COVID inquiry? Because obviously it's been in the news a lot. COVID inquiry starts next week. It's been in the news for, I would say, all the wrong reasons.
Agreed.
Because it's just been a hula baloo about Boris's notebooks, and you can all make up your own mind as to what's gone on there and the politics of that. What I want to see from the inquiry is a sensible, cerebral, professional look at what happened and how we can do better next time. I don't want a circus. I don't want politics. I just think that we owe that to those who lost their livelihoods, and the families of those that lost their lives. So we on the select committee did an inquiry under its previous chair, Jeremy Hunt, actually, coronavirus lessons learned. And we published that in October 21, actually, and the government responded to it in about a year ago, actually. Yeah, a year ago this month, the government responded to it. And it contains a whole series of recommendations. And I want to see that from the inquiry. And obviously, everybody will have their tuppence worth. But my plea to the media would be, don't sensationalize everything. Let it do its work. Let Baroness Hallett do her work. Fair comment?
Absolutely fair. I think you've spoken very wisely about it, Steve. And I'm not always complimentary about you, but I'll give it to you for this one. And again, you could argue the COVID inquiry isn't, we're talking about prevention. But if we get an inquiry right, it will help prevent problems of future pandemics. So I think we can get away with it. You're absolutely right. We owe it to the public. We owe it to those who lost their lives. We owe it to those who've been harmed. We owe it to those with long COVID, and we owe it to those who are suffering the consequences of the financial and economic hardships that have been, that have emerged. We owe it to our young people whose education was disrupted. So yeah, there was a societal, economic, educational cost. I would urge that people aren't hasty about it. I mean, it's tempting that people want quick answers, but quick answers aren't always the right answers. And it's more important to do this well than to do it fast. And so again, and I also think for the media, I mean, it's so tempting for them to try and sensationalize tiny little tidbits taken out of context. But of course, the harsh reality is all of us were working under exceptional situations, and the vast majority of people were just trying to do the best they could in an unknown situation.
And that for ministers too, politicians are human beings as well. Who knew?
Yeah.
I mean, I sort of hope that the evidence that we did in our select committee report that I just mentioned, I mean, sort of to give you some of the headlines. I mean, the UK did significantly worse, was a quote from our thing, in terms of COVID deaths, concluding, quote, "The scale of the early loss requires us to ask why the UK was affected worse than others." And that's one of the reasons why the inquiry was set up. We praised the success of the vaccine program, which is one of the most effective in Europe, if not the world. And we said that, recommendations should center around learning from the pandemic were incorporated into future capability, preparing for similar events, to help those involved and in charge of delivering in the future. And I think hopefully that work that we did, one of the things we said as well was, that the pandemic planning was too narrowly and inflexibly focused on the flu model.
Yep.
It was the draft pandemic flu bill that became the draft coronavirus bill, because that was the number one issue on the government's risk register, which was a flu pandemic. So hopefully the work that we did will feed into the inquiry, and select committees do good cerebral work. Hopefully that's what the inquiry will be.
And what's interesting is, subsequent to the work you did, is the issue about deaths, and the figures of how the UK compared to other countries, of course, have changed over time, as we've seen that other countries, genuine excess mortality has actually been comparably high to the UK. So it may be that the UK was one of the better countries in terms of the quality of its reporting of the whole public, and because of a National Health Service that is a fairly standardized, uniform way of doing things. However, all of that will come out in the wash. I noticed Johns Hopkins University in the USA, who kept the COVID trackers for the globe, they shut down, or they stopped collecting data at the end of March. And at that point, the global death toll was over 6.8 million.
There you go. That's why we got to take it seriously and be serious about it. Anyway, there's a helicopter overhead, which is probably your security arriving for the tug of war, just to make sure that you're safe. And we're going to go and do that now. So I'm just going to say thank you. I'm going to say podcast@stevebryan.com. Find us on social media. Prevention is the new cure. We want to hear from you, your feedback, want to hear your questions and your topics suggested for the pod surgery. It's been fun. It's nice to see you in the same room.
Lovely to see you in person, Steve. Take care.
Till next time. Bye.
Bye.